I have bunions really bad, and my father has it's just a hereditary thing. So I've seen like my grandma and my dad and like what the feet become if you don't get it taken care of. And before living here in Jacksonville, I lived in Kansas City, and I had looked at having possible procedure done up there. And I'm like, oh, there's this new procedure called Lapiplasty. That seems pretty cool. And I saw that Dovetail Orthopedics, like Dr. Santrock, he does it. And I started doing some research, and I'm like, okay, God is so good, because not only is there a surgeon here that can do it, but he is the surgeon who developed the procedure. I need to get it taken care of, and if I can get it done from the man himself, then I mean that's definitely who I want to have working on my feet. So he explained how it's different than other procedures. When they were wanting to develop the procedure, to really look at it from a different way. So instead of just like a 2D fix, it's a 3D. They look at it just in more of a 3D image of how can we move those bones in such a way that it really corrects it, I think, quicker. So what he explained was like, so it's a better fix of the foot anatomically, and as well as it's going to be getting on your feet faster, which is important to me.
Lapiplasty is a procedure that I co-invented. It's a procedure to approach bunions in a different way. Bunions traditionally have been approached two-dimensionally, where you basically look at an x-ray and you're only seeing from the top-down view or the side view, and you can't see maybe the rotation that's happening. By adding that in, which we got from CT scans and seeing people in a weight-bearing fashion, we were able to look at the bones and see they were not just deviated in one direction, they were deviated in multiple directions. So by adding that technology in, where we looked at things in multiple directions and put into place hardware that was allowing people to weight bear right away, we changed how bunions were done. So we approached it three-dimensionally, we made it so you could weight bear right away, and we had a more permanent fix. The other little thing that we did is we put a bunch of technology to it, so the instruments we use make it reproducible. And so for the first 2 weeks, for the most part, a patient who had a foot surgery really needs to ice and elevate. That's their number one job. Now you can move around, and I encourage them to move around every hour. They should be getting up, moving around. That prevents blood clots and gets those muscles pumping.
As far as like the recovery, I tried to be a very good patient. So a lot of icing, a lot of elevating. But 4 weeks after the procedure, I sing in a choir, and I was asked to sing at an event, and I was able to go. Had I had the traditional procedure instead of the Lapiplasty, I wouldn't have been able to be on my feet. So to be able to go and really, it hasn't slowed me down. I can go to the store, I can go to church, I can do all the things that I was doing before. So I would highly, highly recommend, and I already have actually recommended Dr. Santrock, not only for my friend, but my dad, and I'm having the other foot done between Thanksgiving and Christmas this year.